June 8th, 1944, Camp Cook, California. Obergefreiter Hans Schmidt sat in the dental clinic chair, gripping the armrests with white knuckles despite the dentist's reassurances. The 22-year-old Wehrmacht soldier, captured 2 weeks earlier during the Normandy invasion, had never been to a dentist in his life. Growing up in rural Bavaria during the Depression, then serving in the Wehrmacht where dental care consisted of tooth extractions performed by medics with pliers, Schmidt had no frame of reference for what was about to happen. When Captain Robert Henderson, the camp dentist, told him through an interpreter that he would receive a complete dental examination and treatment for his cavities, Schmidt assumed this was either American propaganda or a prelude to interrogation. The reality proved more shocking than propaganda could have been. Captain Henderson examined Schmidt's teeth with patience and professionalism, explaining each step through the interpreter. Schmidt had 7 cavities, severe gum disease, and 2 molars that would require extraction if not treated promptly. In Germany, this would have meant 7 missing teeth eventually, painful infections, and permanent damage. Here, in an American POW camp, it meant 7 fillings, a deep cleaning, treatment for the gum disease, and preservation of teeth Schmidt had expected to lose. When Henderson administered Novocaine before beginning work, Schmidt experienced pain-free dentistry for the first time. The entire experience, the examination, x-rays, anesthesia, fillings, and follow-up appointments scheduled for the next week, contradicted everything Schmidt thought he knew about captivity and about American society. 2 hours later, emerging from the dental clinic with his mouth still numb, Schmidt encountered a dozen fellow prisoners waiting for their appointments. "It's real," he told them in German. "They actually fix your teeth." The American dentist used medicine that makes pain disappear. He took photographs inside my mouth with a machine. He showed me exactly what was wrong and how he would fix it. This isn't propaganda. They're treating us better than our own army treated us. The other prisoners listened with skepticism that would dissolve once they experienced American medical care themselves. Within weeks, the dental clinic became one of the most discussed topics in camp, symbol of American abundance, that forced German POWs to confront uncomfortable questions about the system they had served. The story of German POWs receiving dental care in America reveals truths about both societies that broader narratives often miss. The United States held approximately 425,000 German prisoners on American soil between 1943 and 1946, mostly in camps scattered across rural areas from Texas to Montana, Georgia to California. Geneva Convention requirements mandated that prisoners receive medical care equivalent to the capturing nation's forces. America interpreted this literally, providing German POWs with medical and dental services that exceeded what many Germans, particularly those from rural areas or working-class backgrounds, had ever received. The result was psychological transformation as profound as any military defeat. German soldiers in World War II received minimal dental care. Wehrmacht medical doctrine emphasized combat readiness, not preventive medicine. Soldiers with toothaches reported to medical orderlies who performed one of 2 interventions: prescribe aspirin or extract the tooth. There was no in-between. Mobile dental units existed in theory, but rarely in practice, especially on the Eastern Front, where Schmidt had served before transfer to France. The concept of filling cavities, treating gum disease, or performing root canals was foreign to most German enlisted men. Officers sometimes had access to better care, but even that was limited compared to civilian dentists in Germany's cities, and those dentists were overwhelmed by war demands. The contrast with American military medicine was stark. By 1944, the U.S. Army Dental Corps numbered over 15,000 dentists, serving approximately 12 million men under arms. Every military installation, including POW camps, had dental facilities staffed by qualified dentists using modern equipment. The Army's philosophy was that dental health directly affected combat readiness, morale, and long-term health. Preventing dental problems was cheaper than treating advanced disease or dealing with soldiers incapacitated by pain. This preventive approach, entirely foreign to German military medicine, extended to POWs because Geneva Convention compliance and American medical ethics demanded it. The dental care German POWs received followed the same protocols American soldiers received. Initial examination documented existing problems. X-rays identified hidden cavities and structural issues. Treatment plans addressed both immediate pain and long-term health. Cavities were filled with amalgam or cement. Infected teeth received root canals when salvageable, extractions only when necessary. Gum disease was treated through cleaning and patient education about oral hygiene. Dentures were fabricated for prisoners who had lost teeth before capture. The entire process emphasized preservation and restoration rather than the extraction-only approach German military medicine practiced. Hans Schmidt's experience was typical of thousands of German POWs. His 7 fillings required 4 appointments over 2 weeks. Captain Henderson explained each procedure, showed Schmidt his X-rays, and taught him proper brushing technique. Schmidt received a toothbrush, toothpaste, and dental floss, items he had never used before. The American dentist spent more time on Schmidt's dental health than any German military doctor had spent on his entire physical health during 3 years of Wehrmacht service. This attention to an enemy prisoner's well-being created cognitive dissonance. Schmidt struggled to reconcile with Nazi propaganda about American decadence and cruelty. The psychological impact of American medical care extended beyond grateful surprise to ideological crisis. German prisoners had been taught that Americans were weak, materialistic, and racially mongrelized people who couldn't sustain the sacrifice real war required. Yet here were Americans providing sophisticated medical care to enemy prisoners while simultaneously fighting a global war on multiple fronts. The contradiction forced many prisoners to question what else German propaganda had lied about. If Americans weren't weak and decadent, if they could provide this level of care to enemies while fighting effectively, perhaps German ideology was fundamentally wrong. The dental statistics from POW camps documented the scope of German dental neglect. Medical examinations of incoming prisoners revealed that 87% had untreated cavities, 64% had gum disease, and 23% had already lost teeth to extraction or decay. The average German POW had 4.3 cavities requiring treatment. Among prisoners from rural areas, the statistics were worse. 94% had cavities, 78% had gum disease, and 31% had lost teeth. These numbers reflected not just wartime deprivation, but peacetime inequality. Many German POWs had never seen dentists because their families couldn't afford care that wasn't covered by Germany's health system. The American response was systematic and thorough. Camp dentists created treatment schedules, prioritizing cases by severity. Prisoners in acute pain received immediate attention. Those with infections received antibiotics, a medication many had never encountered. Routine cases were scheduled based on available capacity. The goal was to treat every prisoner's dental problems before repatriation, ensuring they returned to Germany healthier than when captured. This wasn't humanitarian generosity alone, but also pragmatic policy. Healthy prisoners were easier to manage, less prone to disease outbreaks, and better suited for the labor programs many camps operated. Obergefreiter Klaus Becker, captured in Tunisia in 1943, spent 2 years in Camp Breckenridge, Kentucky. He received dental care that included 8 fillings, 2 root canals, and fabrication of a partial denture to replace teeth lost before capture. In a diary kept secretly during captivity, Becker wrote, "The American dentist treated me better than any German doctor ever did. He took time to explain everything, used medicines to prevent pain, and restored teeth I thought were lost forever." When I return to Germany and tell people about this, they won't believe me. They'll think I'm exaggerating or that Americans brainwashed me. But it's simply true. America treats its prisoners better than Germany treats its soldiers. The equipment available in POW camp dental clinics exceeded what most German civilian dentists possessed. American military dental units used portable dental chairs with electric drills, X-ray machines, sterilization equipment, and complete sets of instruments. The materials, amalgam for fillings, Novocaine for anesthesia, antibiotics for infections, were in unlimited supply thanks to American pharmaceutical production. German dentists, even in peacetime, often lacked adequate supplies and relied on older, less effective techniques. The technological gap between American POW camp dentistry and German military dentistry was approximately 20 years. The training American camp dentists received emphasized patient education alongside treatment. Dentists taught prisoners about oral hygiene, proper brushing technique, dietary factors affecting dental health, and preventive care. Many prisoners had never learned these basics. Growing up in Depression-era Germany, they had developed habits that damaged teeth through ignorance rather than neglect. The American dentist's patient education transformed many prisoners' understanding of health maintenance. They learned that dental problems weren't inevitable fate, but preventable through proper care. The broader medical care German POWs received reinforced lessons learned in dental clinics. Camp hospitals treated chronic conditions, performed surgeries, provided physical therapy, and dispensed medications freely. Prisoners received annual physical examinations more thorough than anything Wehrmacht medicine provided. Those with pre-existing conditions like diabetes, hypertension, or heart disease received ongoing management that extended their lives. The cumulative message was undeniable. American medical capacity exceeded German capacity so thoroughly that even enemy prisoners received better care than German soldiers. Feldwebel Ernst Wagner, a career soldier captured in Italy, described the psychological impact. "I served Germany for 12 years, fought in Poland, France, Russia, and Italy. In all that time, I received minimal medical care. Sick call, meant aspirin, and returned to duty. Here in America, as a prisoner, I receive medical attention that exceeds anything German military provided. They fixed my teeth, treated my chronic back pain, gave me eyeglasses I desperately needed. I'm healthier as a prisoner than I ever was as a soldier. What does this say about the system I served?" The cost of providing this medical care to German POWs was significant, but considered worthwhile by American authorities. The average cost of dental care per prisoner was approximately $85, including examination, X-rays, treatment, and materials. Multiply by 425,000 prisoners, and the total exceeded $36 million, equivalent to approximately $500 million today. This expenditure, during a war costing billions monthly, reflected American commitment to Geneva Convention compliance, medical ethics, and pragmatic recognition that healthy prisoners were easier to manage than sick ones. The German POWs' experiences with American dentistry created expectations that would affect post-war Germany. When these men returned home, they had seen what modern medicine could accomplish with adequate resources and organization. They expected Germany's reconstruction to include improved healthcare access. This pressure from below, combined with Allied occupation policies, contributed to West Germany's development of comprehensive healthcare systems that included dental care. The American example, witnessed firsthand by 425,000 POWs, influenced post-war German society in ways political directives alone couldn't have achieved. The contrast with Soviet treatment of German POWs highlighted American approach. German prisoners in Soviet camps received minimal medical care, inadequate food, and brutal treatment. Mortality rates in Soviet captivity exceeded 30%, compared to less than 1% in American captivity. German soldiers knew this before capture, which partly explained why Wehrmacht units in the West often fought to delay Soviet advance, while sometimes surrendering readily to Americans. The knowledge that American captivity meant survival, medical care, and adequate treatment influenced German military behavior in the war's final year. Individual stories revealed how American medical care transformed German prisoners' lives. Gefreiter Otto Schreiber, captured at 19 with severe dental problems causing chronic pain, received treatment including 12 fillings, 3 extractions, and a partial denture. The dental work eliminated pain he had endured for 2 years, pain that had made eating difficult and contributed to malnutrition. Schreiber wrote to his mother, "The Americans fixed my teeth. I can eat without pain now. They gave me false teeth where I was missing molars. The dentist was kind and patient. I am healthier in captivity than I was in the Wehrmacht. I don't understand why they treat enemies so well, but I'm grateful." The religious and ethical dimensions of providing medical care to POWs reflected American values that many Germans found incomprehensible. American medical personnel explained that healing was a moral obligation regardless of patient nationality. The Hippocratic Oath didn't include exemptions for enemies. Christian charity demanded treating all humans with dignity. These explanations confused prisoners trained to believe that mercy was weakness and that different races deserved different treatment. The cognitive dissonance between Nazi racial ideology and American universalist ethics forced many prisoners to reconsider fundamental assumptions. The propaganda value of good treatment wasn't lost on American authorities. The military understood that well-treated German POWs would return to Germany as witnesses to American capacity and values. These men would tell families and communities that America wasn't the barbaric enemy Nazi propaganda described, but a sophisticated society with resources and organizational ability Germany couldn't match. This grassroots testimony from soldiers Germans trusted would be more effective than any official propaganda. The investment in POW welfare was psychological warfare with a long-time horizon. The practical results of dental care extended beyond individual health to camp management. Prisoners without chronic pain were more cooperative, more willing to work in authorized labor programs, and less prone to depression or disciplinary problems. Commanders reported that camps with excellent medical facilities had fewer incidents and better morale than those with minimal care. The correlation was clear. Treating prisoners well made them easier to manage, saving money and reducing security requirements. Humanitarian treatment and practical efficiency aligned. By war's end, American military dentists had performed over 1.8 million procedures on German POWs, including 750,000 fillings, 180,000 extractions, 90,000 root canals, and fabrication of 45,000 dentures or partial plates. These numbers represented comprehensive dental care that exceeded what many Americans received. The military's commitment to POW medical care demonstrated institutional values that transcended temporary wartime hatreds. The American medical establishment saw healing as mission that included enemies, reflecting cultural assumptions about human dignity and professional responsibility. The long-term health outcomes for German POWs reflected the care they received. Studies conducted in the 1950s found that former POWs held in America had significantly better dental health than Germans who hadn't been captured. The difference persisted decades after repatriation, suggesting that the dental care received in captivity plus education about oral hygiene created lasting health improvements. Former POWs also had lower rates of certain chronic diseases, possibly because the comprehensive medical care in American camps identified and treated conditions that would have worsened without intervention. Hans Schmidt, the Bavarian soldier who had never seen a dentist before capture, returned to Germany in 1946 with his teeth restored and knowledge about dental care. He became a vocal advocate for comprehensive healthcare in his community, arguing that Germany should provide to all citizens what America had provided to him as a prisoner. Schmidt's activism, multiplied across 425,000 former POWs, created grassroots pressure for healthcare reform that contributed to West Germany's post-war social welfare development. The American example, experienced personally, influenced German society in directions no amount of occupation policy alone could have achieved. The story of German POWs receiving dental care in America encapsulates broader truths about World War II. Material superiority mattered more than ideology. The side with resources to maintain standards even for enemies possessed advantages the resource poor couldn't overcome. American capacity to provide comprehensive medical care to 425,000 prisoners while fighting global war demonstrated industrial and organizational superiority that decided the conflict's outcome. German soldiers learned this lesson in dental chairs, where American abundance confronted them with undeniable evidence of which system worked better. The final statistics told the story numerically. German POWs in American captivity gained an average of £18, received medical care exceeding Wehrmacht standards, and returned to Germany healthier than when captured. Mortality rate 0.4%, lower than among American soldiers training in the United States. Dental care, comprehensive treatment for 87% of prisoners. Cost $36 million in the 1940s. Result, 425,000 Germans who witnessed American capacity firsthand and carried those memories home to influence post-war German society. When Hans Schmidt died in 1992 at age 70, he still had most of the teeth Captain Henderson had saved in 1944. The fillings, placed in a California POW camp by an American dentist who treated an enemy soldier with the same care he'd give a countryman, lasted nearly 50 years. Schmidt told his grandchildren about the American dentist countless times, always concluding, "That's when I understood we had lost the war." Not because of battles or bombs, but because America could give enemy prisoners better medical care than Germany could give its own soldiers. The side with that kind of abundance couldn't be defeated.